I'm so sorry, doctor. Just 5 minutes more. We'll go
It's
live.
okay. Yeah.
Okay, no, we are good to go. Hi, welcome to this unique hair care initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory, and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, hair problem was associated with middle age when used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems can be managed well if identified early, and much of the hair loss can be avoided. Today, we have with us Dr. Sana, is a well-known dermatologist and hair transplant surgeon, and has been practicing medicine for over many years now. She's MBBS, MD in dermatologist and cosmetologist, and presently working as dermatologist at AIMSR Kollam, Azeezia Institute of Medical Science and Research. Dr. Sana has dedicated her career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to her patient. She takes time to listen to her patient and concern and work closely with them to develop a individual treatment plan. Dr. Sana is aware of the need for the patient awareness and education, and so today she took out some time to give some answer to our questions which are related to hair care and management. Thank you, doctor, for being here and for taking out your time today. Shukriya.
Thank you so much for your valuable introduction, and I'm very happy to be a part of this healthcare in kind of scenario program. And I once again thank Ika and the team for giving me such a good opportunity to talk about the hair. And it is something which is very interested, and everyone wants to know about the hair care in this current scenario.
Yes, doctor. So, doctor, as you already said about hair care, so when we talk about hair care, the first and the foremost thing which come up to our mind is the hair loss, because irrespective of age, we are facing hair problems nowadays, and hair loss is the common one. So, what's normal and when to be concerned for?
Yeah, it is a very nice question initially. And actually speaking, hair loss in my routine OPD, actually about so many patients is coming with this complaint. And it is such that common in this current scenario. Hair loss is that common because about 50% of the patients coming to my OPD is complaining of hair fall. So it is important to know what is normal and what is abnormal. In normal scenario, a person can lose up to 50 to 70 hairs per day, but it is practically impossible to count each hair whether it is 50 or 70. So when should we get concerned that which is normal? The patient itself is a critic for me, because the patient is who is taking the trouble to come and visit a dermatologist and saying that, doctor, my hair is losing, means it is a significant hair loss. So there is no practical number that it should be 50 or it should be 100. The patient itself is saying, doctor, I am losing my hair more than the normal hair loss. So I will consider it definitely their hair loss only. And the significant, or once the patient should be concerned, is that when there is a thinning of hair, once the scalp is visible to the patient or their home makers, or if the pillow cover is clogged with hairs, if the washroom is clogging with hair, the cleaners are saying that your room is filled with hair. So it should be taken into concern, and it is the time actually to meet a dermatologist before considering that is a significant hair loss of more than 100. So it is yearly treatment or yearly consultation with the dermatologist can make you regrow the hair faster.
Okay, doctor. So, whenever some people are noticing, or we are noticing, more than 100 or 200 hairs are falling, so that's the time we should visit to the doctor instead of avoiding them.
Yeah, exactly. There is no number, because the patient itself will come and say, like, this much bunch of hair is falling from my scalp, doctor.
Okay, doctor. So, doctor, now that we know that what's the alarm sign are, so another question which comes into our mind is, what are the general causes of hair loss? Why do this happen?
Yeah, coming to the general causes of hair loss, it is a very broad spectrum, actually speaking. and it depends upon various factors mainly. So simply saying, like in common man terms, we can classify the general causes of hair loss into various categories. Like if we are considering the age, if it is a child, then the most common cause for hair loss is vitamin deficiency, as well as some infections like bacterial infections, fungal infections. This can cause hair loss. If it is coming to an adult age group patients like men and women, the most commonly seen cause of hair loss is pattern type of hair loss. That is male pattern hair loss and female pattern type of hair loss. And the other comes in diffuse type of hair loss. Then comes a patchy type of hair loss. Patchy type of hair loss means localized areas of hair loss. It will not be generalized. Then comes other causes which is causing hair loss, like the patient is on chemotherapeutic drugs, or the patient or the women or ladies taking routine salon procedures like chemically, hair blow drying, taking harsh chemicals, shampoos and conditioners, which might cause hair loss. Then nutritional deficiency. Then those who had postpartum deliveries, postpartum stress, which is causing hair loss. So there is multifactorial causes for hair loss.
Okay, so many causes are there. So, doctor, that does a person lifestyle can also play a role in hair loss, because nowadays we all are like sleeping late and no time to cook, so we are eating anything, and so does it matter for hair health?
It's a very such an excellent question once again. Like the lifestyle definitely plays a major role in hair loss. As I said earlier, in the current scenario, why this much common the hair loss is the one answer for this is the lifestyle, because we all are under stress. Lifestyle means not only stress, improper diet, improper sleep. All these will affect our overall health, which in turn causes complete hair loss. So lifestyle modification is very mandatory, and lifestyle modification includes proper sleep up to 8 to 10 hours, proper diet with balanced diet with most colorful vegetables and fruits which is available in the seasonal markets. Then proper sleep and proper intake of water, and along with supplementing nutrition if it is necessary by consulting a doctor. So yes, lifestyle modification is must for hair loss.
Okay, doctor. So, what are the treatment, like medical treatment options available? Like, is there any topical or oral or surgical or non-surgical? Now, how can we manage this hair problems?
Yeah, so as I said earlier, there is multifactorial causes for hair loss. So once the patient comes to us, initially we have to assess the patient by general examination of the scalp. So nowadays, the newer intervention of dermoscopy, or otherwise known as trichoscope, has made it very easier to find whether the hair loss is permanent, whether the hair loss is reversible, whether the hair loss is irreversible. With a simple instrument known as dermoscope, we can assess the patient's hair fall, the condition. So the primary pathology can be easily assessed by a dermoscope. So once the patient comes to the OPD, and if we have a doubt if it is irreversible hair loss or is it a reversible hair loss, we use a dermoscope and first assess the scalp of the patient. Secondly, we will rule out the cause. If it is a nutritional deficiency by doing blood investigations, we will rule out the cause. If the patient is having vitamin D deficiency, thyroid abnormalities, if the patient is having PCOD with hormonal imbalance, with hormonal panel test, such the needed patients will be subjected to certain investigations. Then otherwise we will take a proper history if the patient is having taking any drugs, if the patient has undergone any surgery, if the patient undergone any delivery, such histories will be taken. After ruling of the cause, we will start the treatment. So commonly adult patients comes to us with hair fall, and as I said earlier, adult patients means male and female comes with male pattern and female pattern hair loss. For such patients, example, I can give topical minoxidil, which is a FDA approved medication, and it is topical as well as now available as oral medication as well. So which helps in preventing the miniaturization of the hair. Then comes peptides, growth hormones like procapil, redensil, etc., like hair growth serums, which enhances the hair growth for diffuse hair loss. While coming to patchy hair loss like autoimmune disease like alopecia areata, then the treatment varies. There is not only topical application or topical supplements, oral supplements. We should give like intralesional steroid therapies, like injections to the patches. Then comes complete baldness of the hair, where the patient is losing almost the hair, like frontal and temporal recession. Then the patient asks, it will not be controlled with a topical or oral supplements. We should give like hair transplant, surgical procedures like hair transplantation or micropigmentation, many procedures coming out, camouflage methods. So according to the course, the treatment varies from topical application, or it is a oral supplementation or surgical procedures.
Okay, very informative, doctor. I think there are a lot of treatment options available, and
Exactly. And the
yeah.
most commonly doing now, which is famous, is PRP, GFC procedures, and mesotherapies, which is showing very excellent result for diffuse hair loss patients.
So, doctor, like one word is like these days getting a lot of focus, like name called nutraceuticals. So, what is nutraceuticals, and what is the role of nutraceutical in hair health?
Yeah, again, nice question. Like nutraceuticals, uh, now, so everyone is influenced in social medias, and it is going viral. So many multiple products for hair loss has been published, and every social media influencers are speaking about so many products over the counter. So nutraceuticals, and to know about nutraceuticals is very important according to a hair loss patient, because they blindly go and buy something which is available in the supermarkets, and it is further causing some damage to their body. So nutraceuticals, in simple words, it can be said a mixture of nutrients, minerals, vitamins, essential minerals, etc., combined together, which has been undergone multiple researches and studies, whether it is safe in humans, and after the pharmaceutical companies had manufactured it in such a way that it is not causing any harm to the human beings. And such nutraceuticals are only available as a which is dermatologically tested and pharmaceutically proven, which is not harmful to the patients. And as I said, it is a mixture of these many things, and after so many trials, it has been marketed in the pharmacies. So nutraceuticals are a combination of these many important things, which is useful for hair loss. And this should be taken under the consultation of a dermatologist, because a doctor can only assess the patient's values for such, like his recommended daily allowance is given for each nutraceuticals. So according to the patient's need, we will supplement the nutraceuticals.
Okay, doctor. So, doctor, like there is like herbal, also plant extract, also phytoconstituent. Are they really useful for the management of hair problem like alopecia?
Yeah, again, some of the like Instagram reels are showing so many plant extract materials like rosemary oil or onion seed oils, then grape oil, so many oils. Like, so, actually speaking, these plant extracts historically they had been said to be proving like promoting hair growth. But in actually, there is a true school of thoughts. Actually, these plant extracts have been taken and is being promoting the hair growth means some products like coconut oil, like sesame oil, argan oils, these can penetrate into the hair diameters and cause the promotion of hair growth by stimulating the hair cells in some way. But application of plant extracts, which is not it in a filtered manner, or which is not tested by the pharmaceutical companies, and blindly applying to the scalp may cause some side effects like allergic contact dermatitis, like some Ayurvedic products. So these should be tested by proper pharmaceutical companies and have been completely undergone so many researches. And those products which is implanted, which is incorporated in our hair serums, like dermatologist tested hair serums, is safe to apply, and it does play a major role in hair growth. But so the selection of the plant extract products should be done under a dermatologist, so it can be safely applied.
Okay, instead of blindly taking it, better to visit the doctor and take the prescription and
Exactly.
then apply
Yes.
accordingly.
Exactly.
Okay, doctor. So, very interesting, doctor. Like also like similar question which we have in our mind, like do plant extract like grape seed, omega-3 fatty acid, do they promote hair growth?
Yes, definitely they do promote hair growth because as I said earlier, in the nutraceuticals which we are providing, which we doctors are providing, has some major components like these grape seeds, omega-3 fatty acids, because the studies have proven that I said no, these things have been undergone so many researches and finally coming into the markets. So studies had proven that these plant extracts like grape seed oil, millet seeds, etc., plays a major role in activating the hair growth by promoting the nutrients to the hair bulb area. So some of the examples are millet seeds, grape seeds, omega-3 fatty acids, and some of the evening primrose oil, which is gamma linolic acid, which is also proving that inhibiting dihydrotestosterone enzyme, so which is causing the miniaturization of the hair. So in androgenic alopecia, it do play a role. So the combination with a definite required daily allowance with the pharmaceutical products will help in promoting the health.
Very interesting, doctor. You have mentioned so many nutrients, and we have like so many are there. So, what are like macronutrients and micronutrients? Can you enlighten us? What is the role of these micronutrients in hair health?
Yeah. So as I said earlier, nutraceuticals again can be divided into, as you said, micronutrients as well as macronutrients. So what is micronutrients means, as the word suggests, micro means it is needed only in lesser quantity for the body, while macronutrient is something which is needed in more quantities. So macronutrients usually we can get through all daily basis from all our food which we are taking, carbohydrates, proteins, lipids, etc. While micronutrients something which is should be supplemented through certain foods like iron, vitamin D, copper, selenium, zinc, etc. So these micronutrient deficiencies more common in this current scenario because patients will not be taken that much green leafy vegetables rather than the patients are taking so much of junk foods. So these micronutrients should be supplemented accordingly if the patient is having hair loss with the required daily allowance. So what this micronutrients enhances means they enhances the growth hormones. They enhances the growth hormones needed for the proliferation of the hair cells. So thus it enhance and play a major role for the hair growth.
Okay, so these nutrients are like food for our hair.
Exactly.
And yeah. So, doctor, is it required to take these nutrients as per gender RD requirement?
Yes, of course, it should be taken at RDA requirement because anything which is more than the limit can cause harm to the body. So I said, no, once we examine the patient and if the patient is deficient to some of these things, some of these vitamin D, or if the patient is deficient to iron, if deficient in zinc, vitamin B complex, then definitely we should supplement the nutrients according to the RDA. And it is very easy nowadays because certain best pharmaceutical companies have been coming up with this RDA requirement for gender, like for females, for males, then with according to the BMI. So everything it is differing, and the pharmaceutical companies are coming up with those products which is given specifically to the male and specifically to female because in a childbearing age group, like females will have a more deficiency of iron compared to a normal male. So iron content and copper content or etc. should be added more for the female tablets comparing to the male nutraceuticals. So it should be taken in the RDA requirement to prevent side effects like hypervitaminosis.
So excess of this can also lead to problems. It's always better to take in terms of requirement, and those requirement can be, prescribed by the doctor. So we should visit to the doctor.
Yeah.
So, doctor, another very common problem which is faced by us is dandruff. So, can dandruff cause hair fall or hair problem?
Exactly, dandruff can cause hair problem. As I said earlier, once the patient comes to the OPD, first we will examine the scalp. So one of the cause for hair loss is dandruff itself. So dandruff is nothing but it is an inflammatory condition along with some fungal growth. So it will actually change the environment's normal pH of the scalp, which is not providing a good health or good hygiene to the scalp. So dandruff itself can cause some irritation, scratching, so which will irritate the whole over the scalp and hair growth cycle. So dandruff may cause and it definitely cause hair fall. So proper dandruff treatment is necessary by consulting a doctor because dandruff itself is not common dandruff which we say seborrheic dermatitis. It can present as other conditions like psoriasis of the scalp, the patients who's having atopic dermatitis. So those conditions also present with scaling of the scalp, and it should be assessed from normal dandruff or it is associated with some skin conditions. And accordingly, the treatment should be given because each of every the like dandruff-like conditions can cause hair loss.
Okay, so it is also required to manage our dandruff problem instead of ignoring it.
Yeah.
Okay, doctor. Nowadays, we are all like stressful and like lot of work from home is like also no time to sleep and overburden. So, can you please enlighten us today? Like, what is the impact of stress on our hair health?
Yeah, as I said earlier, the lifestyle modification is very necessary to provide a good health to our body. And one of the major factor for not getting a good health is the stress only. So everyone is under stress either due to examination, either due to their job, either due to their family planning. So many reasons to have to be stressed, right? So stress is assets not at all good for our total body health. So total body health impact makes our skin looking glowing, our hair, our nail, everything should be normal if our health is normal. So stress plays a major role in negative impact of our body health. What happens when we are taking stress means if we having lack of sleep, if we're not taking proper nutritional diet, then what is happening is there is a releasing of stress hormones from the adrenal glands of the body. So these stress signals and stress hormones like cortisol, which has a bad or negative impact on hair growth cycle, which is causing the growing phase of hair cycle to go into the sleeping phase and finally the shedding phase. So the hair cycle is completely disrupted due to the stress hormones. So actually the impact of stress is a very major factor in hair loss criteria, and we should avoid taking stress by supplementing, substituting it with yoga, exercises, listening to music. Get some time to get relaxed and free, spend time with family, other than completely involving in other our jobs and other stress. Speak to someone like that.
Okay, doctor. So, doctor, when we are stressful, and also our mother at home tell that apply oil and use excess amount of oil on our scalp and give the massage to relax yourself, and this oil will also help us to grow, thick and long hair. So, is it true like oiling hair is boon or a ban?
Actually speaking, oiling hair, both can happen, bone as well as big. Because as historically it is said that oil promotes hair growth, but that fact is always false. It is not true always. As I said earlier, some of the plant extracts like coconut oil, argan oil, sesame oil, these can do penetrate into the hair follicles because they're lower density molecules. So it can get penetrated and it provides nutrition to the hair follicle. But thinking at the actual fact that since the hair is little more longer and we are applying the oil to the scalp, so up to which length can this oil get reached? So actually speaking, the complete hair length will not be benefited with application of hair oil to the scalp at one point of view. The other point of view, the hair oiling and massaging and doing spa can increase the blood circulation over the scalp and it can relieve us from the stress. So at one point of view, it is beneficial, but doing it regularly can cause harm to the scalp as well as the hair. And using proper coconut oil or proper sesame oil, which is manufactured by nice companies, which is not harmful to the scalp. We have hair growth serums, with argan oils, etc., which is manufactured in such a way that it is not causing harm to the patients. And we advise the patients to apply it weekly twice or weekly thrice, not in a daily basis, because so much of oiling can cause accumulation of dirt, increase the dandruff. For dandruff patients, we will definitely say no to application of oil. Otherwise, they can use oil in a weekly once or twice and can wash off the excess of oil with using a mild shampoo or conditioner, and in such a way that they can use oil. And these oil products are also now manufactured by the pharmaceutical companies, which is not harmful itself.
Okay, so instead of oiling and keeping it for long hours is not good.
Yeah, yeah.
We should wash it off. Yeah.
Exactly.
Okay, doctor. Very interesting, doctor. So, doctor, can you please give us some important tips for healthy hair?
Yeah. Overall, by speaking like a summary, for an healthy hair, we should actually improve our lifestyle, which is one of the most cause for hair loss nowadays. Why it is more common in this current scenario is actually it is due to the lifestyle. So we should take a proper sleep. We should take a proper balanced diet with more of vegetables and fruits than junk foods and oily products. Then, by taking proper nutrition, the nutrient supplementation according to a dermatologist or a physician consultation, rather than taking blindly from over-the-counter products, which is very harmful to the for our own bodies. So it should be taken at the required daily allowance dosages, and specific time periods are given according to the patients after consulting the doctor. The doctor says to take about 3 months, 6 months according to their deficiencies. So always take such pharmaceutical products by consulting a doctor. Then follow regular exercise, relieve the stress by going to yoga or singing, dancing, taking a routine habit of take some time to nourish our body itself. Give some time for ourselves so that we can relieve from all this stress and everything. Spend time for some time with family. Do the things which is making happy for yourself. So everything can influence and keep our overall health, which in fact reflect our body, like so providing with a good hair, shiny skin, and everything.
Yes, thank you so much, doctor. This discussion was very informative, and I'm sure our viewers would be benefited by it. So, doctor, can we take some live audience questions, please?
Yeah, sure. Yeah, sure.
Okay, the first question from our viewer is, "Hi, doctor. I have been facing hair loss problem for a long time. So my question is, are there any alternative? How can I prevent further hair loss in future?"
Yeah, since you are that much concerned and you are considering like the patient is saying that hair loss is more compared to normal, so it is definitely the time to visit a doctor. As I said earlier, the hair loss should be assessed by direct examination of the scalp. We should know whether it is generalized hair loss, whether it is patchy hair loss. So considering the cause of your hair loss, we can give the treatment accordingly. So first, the root of the cause of the hair loss should be found out, and you should most early consult a dermatologist or the trichologist to get the proper treatment for your cause of the hair loss.
Okay.
And yes, you can. It can be treated by supplementing with nutrients, nutraceuticals, which is provided by the doctor, with for a shorter duration of time.
Okay, doctor. Very interesting. Another question from our viewer is, "Doctor, I'm facing problem of androgenic alopecia, and doctor gave me some vitamins and mineral. Do I need to take these vitamins and minerals for like whole life?"
As I said earlier, if anything is more or which is more than the limit, it will definitely cause harm to the patient. So nothing is such like that to make life flow, except like topical minoxidil, which is a FDA approved medication for androgenetic alopecia. As we say, it should be taken for a longer period compared to other oral supplements like biotin tablets, nutraceuticals, which should not be taken for a longer period of time, which is definitely going to cause harm, like I said before, like hypervitaminosis. So ideally, we usually give nutraceuticals and other supplementing products for about 6 months, 6 to 9 months, and again we have to give the body that rest. Is the body able to produce those by modifying your lifestyle and supplementing with the nutrients? Is the hair loss coming back, regeneration is taking place? We should give the body for that time to regrow, other than taking the supplements for a very long time and causing harmful side effects to the body.
Okay, doctor. Very interesting. Uh, Hi, doctor. I've been facing a hair loss problem after my pregnancy. Is there any test or any routine checkup which I can go for to detect whether I have a hair loss problem or not?
Yeah, this is a very common other scenario coming to the OPDs daily, because as I said, stress comes under different categories, and one of the stress is postpartum delivery. The mother is giving birth to child, and all over the body is recovering from a very huge process. So definitely there will be stress and there will be hair loss, and the period of hair loss, which is known as telogen effluvium, that means a stress-induced hair loss. The term which we use is telogen effluvium, and the postpartum telogen effluvium can be lasting for about normally for 6 to 9 months. Every postpartum delivery patients will have hair loss for about 6 to 9 months, and if it is very severe and that is there is thinning of hair, visibility of scalp, then you should definitely go and consult a dermatologist, because there might be deficient of some nutrients, like most commonly vitamin D, iron. And so the proper supplementation can help you with going into chronic telogen effluvium if it is taken earlier.
Okay, doctor. So are there like any yearly routine checkup like we do for our sugar test and also are there any yearly routine checkup for hair health also?
Yeah, exactly. Because nowadays, due to our very bad lifestyle, like using junk food, taking so much oily products, packet food items, we are not getting sufficient nutrients. So, if a person is getting so much of hair loss, then they can go like a routine investigation, which we suggest to the patients. It's vitamin D, then a thyroid hormone, like thyroid stimulating hormone test, as well as ferritin. Then comes the iron, vitamin B complex, and zinc and selenium test, which is further categories depending upon the course blood investigations goes on. So the most commonly advised blood investigation is vitamin D, iron, and the thyroid panel test.
Okay, okay. Very interesting, doctor. Another question is from our viewer is, doctor, I got I'm at an accident during a burn condition and my hair is burned from frontal part. I want to go for hair transplant. Can it be done?
Yeah, as an injury has been caused to the scalp, to the hair areas. So, as I said earlier, with our very beautiful and coming upgraded instrument like dermoscopy, we can actually look whether the hair follicles are intact or whether there is completely irreversible hair loss has been happened, such that the hair follicles is completely scarred. That is like that of scarring alopecia, because there is fibrosis and complete damage of the within the root of the hair. We can just examine through trichoscopy, or otherwise can do further simple bedside procedures to look whether the hair follicle is intact or not. If the hair follicle is not intact and if there is no chance of regrowth of hair, then we can go for hair transplantation. But also we have to look whether the area is properly supplemented with blood circulation. If there is no blood circulation, then there will not be able to supply the nutrients and minerals which is needed for new hair to grow. Because hair transplantation is taking an hair and placing it to that area where the hair is not coming, but there should be proper circulation. So it should also be consulted by a dermatologist and a trichologist to evaluate the loss of the hair areas and what is the condition of the current condition of the scalp where the hair is lost, and we can go accordingly.
Okay, so there solutions are there, but we should
Yes,
meet to
solutions
the
are there.
doctor.
Yeah.
Okay, doctor, very interesting. Another very interesting question asked by one female. Doctor, my female friend told me that design of the comb also matter. So should I use thin thick comb? Which comb is better to use for the hair health?
It is actually a good question. Comb, usually, yeah, everybody is using combs of different types, but it is better to use white combs, like white teeth combs, because it causes lesser damage to the scalp. If there is a gap between the teeth of the comb, then the damage caused to the scalp is lesser. And wooden combs are better than plastic and other low quality combs, because it is naturally made and it does not cause that harm to the scalp. If there is a hair fall, multiple hair loss patient, then it is definitely helpful with a wider toothed combs rather than closed tooth.
Okay, very interesting, doctor. Because we are running out of time, I quickly take the last question from our viewer. Doctor, my daughter is 12 years old and she's facing a white hair problem. Why at such a young age she's having white hair, and is there any solution for it?
Yeah, this is also another common scenario nowadays, because I don't the proper etiology is not yet been found out, but maybe some due to improper diet or the nutrition deficiencies, improper balanced diet. Exactly, something is causing this premature graying, which is known as canitis. Now this child is only 12-year-old and she's getting gray hair. So some nutritional deficiency may play a role. There are many multifactorial causes, and one thing is genetic. If the parents is having graying of hair at the earlier age, definitely the child will get that condition. And otherwise, nutrition deficiency, genetic factors is very difficult to treat because it is genetically implemented condition. So they can go with coloring, or some agents are now being manufactured nowadays in pharmaceutical companies, which helps in preventing graying of hair by making it regrowing with black hairs. And other thing, if it is the patients having nutritional deficiency, we will advise some panel blood investigation like vitamin B complex, selenium, zinc, etc. And if it is deficient, definitely we can supplement it with it, and we will give it for a period of 6 to 9 months and watch for regrowth hair with black hairs. So definitely at earlier stage of treatment, earlier stage, we can bring back the hair to the black color. If it is late and if it is having a genetic factor, then it is a bit difficult to treat condition. There are treatment options.
Okay, so this can be stopped.
Yes.
So, doctor, can genetic conditions can also cause hair problems?
Exactly, genetic cause can, because as I said, male pattern and female pattern, there is androgenetic alopecia. If familially the father or mother is having that condition, yes, genetic pattern do play a role in hair loss.
Thank you so much, doctor. Doctor, would you like to give a take-home message to and suggestion to our viewers today?
Yeah, so summarizing finally, hair is one of the most aesthetically important thing, like cosmetically important thing to a person. So if the hair loss is that severe and if it is not in our hands, and you can definitely go and consult a dermatologist and a trichologist so that they can assess the cause of your hair loss and give you the treatment at the earliest. Because by going into chronic hair loss and baldness, we can get the treatment earlier, and so many pharmaceutical companies with the efficient nutraceuticals are now available in the market, which is dermatologically tested and can be safely taken for a shorter duration of time, which can prevent the hair loss to going into very huge hair loss. So earlier treatment by consulting a doctor is necessary, and taking any hair care products like shampoo or conditioner or nutraceutical biotin tablets should be under the a consultation of a dermatologist. And follow a good health by giving proper diet, proper time to yourself.
Okay, proper diet and proper time is also necessary to have a healthy hair. Thank you so much, doctor. Thank you so much for sharing so much of information and all your expertise with us today and answering all the questions of our viewers. I'm sure our viewers have found the session very helpful. Thank you, doctor. It was a delight to have you, and thank you so much for your valuable time.
Yeah, welcome. Welcome. And again, I thank you to Anger in such a beautiful way. And it was a very nice questions. And it will be definitely useful for the viewers. And many of the doubts have been at least cleared through our session. Thanks once more to Deepika and the team.
Yes, doctor. Thank you, ladies and gentlemen, for joining us today. This is Mona Sharma signing off for today. Thank you, doctor. Have a good evening.